Good day everyone, I am 𝐬𝐨𝐜𝐿𝐢𝐚 canumay from BSN 111B, and today I will be showing you my return demonstration in administering oral medications. Oral administration is the most common, least expensive, and most convenient route of administration for patients. Hence, it is important to remember and adhere to the 10 rights of medication administration to avoid making errors and ensure the safety and well-being of our patient. So the 10 rights of medication administration includes right medication, right dose, right time, right route, right client, right client education, right documentation, right to refuse, right assessment, and right evaluation. So prior to the conduct of the assessment, we need to check for the physician's order to know what medication should be given to the patient. Okay, so this is the physician's order or the doctor's order. Okay. Now we need to check the MAR or the medication administration record with physician's order with drug name, frequency, dosage, and route of administration. Next, verify the client's ability to take medication orally. Okay. Now we need to organize the equipment needed and bring the requisites to the preparation area. So the requisites include a medicine cup, medicine dropper, medicine tray and gloves, a cup of water, BP apparatus or the sphygmomanometer, and lastly, a stethoscope. So now I'm going to perform proper hand hygiene and wear gloves to protect myself and of course my patient from cross-contamination. Now we need to read the MAR and take the appropriate medication in the box, read the label, and remove the medicine from the box. Compare the label of medication to the order on the MAR or computer printout. And then recheck the label of the medication with the MAR and note the expiration date. For the preparation of the prescribed medication, for capsules or tablets in a bottle, gently shake the prescribed amount of capsules or tablets into the bottle cup. Okay, once you have poured too many or too much capsules or tablets into the bottle cup, you can place it back into the container. Okay, and once you have the right amount of capsules or tablets into the bottle cup, you can now place it into the medicine cup. And then close the container. Always remember that once the capsule or tablets are placed into the medicine cup, it means that the capsules or tablets are no longer sterile and you cannot put it back into the container. Okay, so moving on the tablets or capsules in a box, gently shake the prescribed amount of capsules or tablets into the medicine cup. Now for liquids or suspension, thoroughly mix the medication and then remove the cup and place it upside down on the countertop. So this is done to avoid pathogens from submerging into the medicine. And then hold the bottle just like this. so that the label is next to your palm, like that. And then pour the medication away from the label. So this is done to avoid dripping of medication into the label. And after that, place the medicine cup on a flat surface at eye level. Okay, and then place your thumb on the prescribed level and read at the lower meniscus. So a meniscus is a curve in the surface of a molecular substance when it touches another material. So this is done to have an accurate reading of the measurement of the liquid medicine. And now pour the exact amount of the medicine prescribed into the medicine cup. Okay. And now wipe the rim of the bottle before cupping it. So this is to prevent the cup in sticking. And then throw it into the garbage can. And then close the bottle. Now for drops, using a medicine dropper, gently draw the needed amount for medicine and place it into the medicine cup. Now, place the prepared medications and the MAR on the same cart and also check the patient's room number against the MAR before entering the patient's room. It is important to close the door to provide the patient with privacy. So now we need to introduce ourselves to the client and verify the client by asking his full name or checking his wristband. And also, we need to ask the client about any allergies. Good day, sir. I am 𝐬𝐨𝐜𝐿𝐴, your student nurse for today. Can I see your wristband, please? Can you state your name?
I am Patrick Anay.
Your birthday?
It's on April 26, 2002.
Okay, and how would you like me to call you?
Just call me Mr. Patrick.
Okay, Mr. Patrick, at this time, I'm going to give you your medication as ordered by your physician, Dr. Yang. So may I just ask if you're aware of any allergies you might have from any medication or drugs?
No, I don't remember any.
Okay. So if the medication to be given is highly acidic, such as aspirin, it can be given with a snack such as crackers if food is not contraindicated. So at the client's bedside, match up the MAR with the names of the medication as shown on their label with the client's name. Okay, so if necessary, perform the pre-administration assessment such as taking the blood pressure, pulse rate, and respiratory rate. Okay, Mr. Patrick, before I give you your medications, I'm going to check first for your blood pressure, pulse rate, and respiratory rate. Would that be alright?
Yes, it's alright.
Okay. So now I'm going to check first for your pulse rate. Just relax, okay?
Okay.
Okay. So now I'm going to take your blood pressure. Okay, that's good. Your blood pressure is 120/80, which is in normal range. Okay?
Okay.
So now discuss the purpose of medication, including its relevant information such as its action and possible side effects. Okay, Mr. Patrick, Dr. Yang has prescribed you with glimepiride. Its generic name is Jetril, with a dosage of 2 milligrams to be taken every after your first meal. Okay? So it is in tablet form, which means you have to take it orally. Okay? So this type of medication is an oral hypoglycemic agent whose primary mechanism is dependent on stimulating the release of insulin from functioning pancreatic beta cells. Okay? So upon taking this medication, you might experience dizziness, headache, or nauseated. Okay? So if this symptoms is intolerable, do not hesitate to ask for help using the button on your right side. Okay? Also, Dr. Yang prescribed you with Semethine. Its generic name is Semethine, with a dosage of 200 milligrams or 5 ml in suspension to be taken every 6 hours. Okay? So it is in syrup form, which means you have to take it still orally. Okay? So this type of medication is an antacid drug used in the reduction of gastric hyperacidity. Okay? So upon taking this medication, you may experience constipation, diarrhea, or nauseated. Okay? So again, if it is intolerable, do not hesitate to ask for help. Okay? And lastly, Dr. Yang prescribed you with cholecalciferol or vitamin D3 with a dosage of 1 drop containing 1,000 international units or 25 micrograms to be taken once daily. Okay? So it is in drops form, which means you have to take it orally. Okay? So this type of medication is a dietary supplement which is used in treating vitamin D deficiency. Okay? So upon taking this medication, you might experience chest pain or itching. Okay? So if you experience any of these symptoms, do not hesitate to ask for help. Okay? Okay. So now assist the patient in sitting position or side lying position. Okay, Mr. Patrick, I need you to sit down. Okay? Okay, for a while. Okay, I need you to sit down. Okay. Okay. Okay, Mr. Patrick, are you okay in taking your medication in that position?
Yes, I'm okay.
Okay. So now administer the medicines and do not forget to provide the client with adequate water or prefer juice in swallowing the medicines. Okay, Mr. Patrick, here is your Jetril. Okay. Okay, and here is your Semethine. Okay. Okay, and your vitamin D3. We need you to open your mouth. Okay, and water. Okay. Okay, so stay with the client until all the medication has been swallowed. Okay, Mr. Patrick, since we're done with your medication, I'm now going to head out for you to have some rest. But before that, do you need anything else?
No, none.
Okay, so after a few minutes, I'll be back to check you up, okay?
Okay.
Okay, so thank you for your cooperation, Mr. Patrick, and have a nice day ahead.
Thank you so much for your service.
Okay. Now that I am done with the administration of medication to the patient, I will now proceed to the documentation process of the procedure which I have just done. So the documentation includes the type of medication, the route, and the time it was given. So I have given my patient 3 types of drugs. So the first one is in tablet form, which is an oral hypoglycemic agent with a brand name of glimepiride and a generic name of Jetril with a dosage of 2 milligrams and a frequency to be taken every after the patient's first meal. So the second type of drug that I have given my patient is in syrup form, which is an antacid drug with a brand name of Semethine with a generic name of Semethine with a dosage of 200 milligrams or 5 ml in suspension and a frequency to be taken every 6 hours. So the last type of drug that I have given my patient is in drops form, which is a dietary supplement with the brand name of 𝐬𝐨𝐜𝐿 or vitamin D3 with a dosage of 1 drop containing 1,000 international units or 25 micrograms to be taken once daily. Also include in the documentation for any complaints from the patient, and if the medication has been refused or omitted, then document the reason for the omission. Also, don't forget to affix your signature on the documentation sheet, which will signify that you have carried out the doctor's order. Okay, so now that I am done with the documentation, I will now proceed to replenish the stocks and return the car to its appropriate area and then perform the aftercare of the equipments used by washing or cleaning them and returning them to its appropriate place. And then don't forget to perform proper hand hygiene. So that's it for my return demonstration. I am 𝐬𝐨𝐜𝐿𝐴𝐚. Thank you for watching.